So welcome to the Parent Craft classes. This is class number 1 out of 4. We're going to be doing some videos for all of the classes. My name is Stacey and I work at the Birth Centre and I work between South Tyneside and Sunderland. The first class that we're going to do today is antenatal class, and that is about health during pregnancy. So obviously you can see that we have 2 services offered to the women of South Tyneside and Sunderland. We have our midwifery-led birthing centre at South Tyneside Hospital, and we also have our maternity unit at Sunderland Royal Hospital. So we're just going to go through a few changes that we've had obviously in the recent months due to the COVID-19. So things might be a little bit different when you come to visit at the hospital. All staff will be wearing protective equipment, so that will include a mask, an apron and gloves whenever they do any clinical examinations of yourself. You will now have telephone assessments with your community midwife prior to 28 weeks. You will then see your community midwife at your normal GP practice from 28 weeks for your regular appointments. We'll have guidance that everyone who enters the premises of either the birthing centre or the maternity unit at Sunderland should wash their hands upon entering and leaving both the department and the room that you are allocated to. Currently, we have no visiting across both sites, so you will only be allowed to have your birthing partner with you during labour and postnatally. Women are allowed 1 birthing partner once you are confirmed to be in established labour. Your birthing partner is allowed to stay with you on delivery suite or in the birthing centre during your whole stay. They will not be permitted to leave the room or the department. If they do, they will not be allowed to re-enter. If you have any symptoms of COVID-19 prior to any attendance to the hospital or any appointments, you should contact the hospital or your community midwife and let them know. So we're going to go straight into the health in pregnancy. So the first trimester, this is when your baby grows the fastest, and this is between 1 and 12 weeks. So this is the early part of your pregnancy. Between 8 and 12 weeks, you will be offered a date and scan, and this is where they measure your baby and give you your estimated date of delivery. By 12 weeks, your baby's bones, fingers, toes and muscles and all of its organs have formed. At this point, your baby looks like a tiny human but is now being called a fetus. He or she will be practicing swallowing. Your baby is between 7 to 9 centimetres long. This is a to scale picture and it is roughly the size of a lemon. So between 13 and 28 weeks, this is classed as your second trimester. During this time, your energy level should increase, your bump will start to grow and become more noticeable. You will be offered some blood tests and you will also have a 20-week scan. This scan is used to check for any abnormalities with your baby and to make sure that everything is growing normally. After 20 weeks, you will then start to feel your baby move. This may start off as flutters first of all, but then you will start to feel distinctive movements. Your movements will then settle into a regular pattern which will be normal for your baby, and this is different for every woman. If you are ever concerned about your movements, you should contact the hospital or contact your midwife for advice. By 28 weeks, the fetus is 28 to 35 centimetres long and can open and close its eyes. This is a to scale drawing of the baby at 28 weeks, and it's roughly the size of an aubergine. So the third trimester is between 29 and 40 weeks. Feelings at this stage of the pregnancy tend to go from tiredness and worry to excitement about your impending delivery. You'll have more antenatal checks with your community midwife, and these will be more frequent. You will be offered a whooping cough and a flu vaccination from your community midwife, and this may be at your GP surgery. The position that your baby is in becomes more important during this trimester, and you will have lots of abdominal examinations to determine the position and presentation of your baby. It is important to remember that you should now go to sleep on your side at night and not lie on your back or your front. By 40 weeks, your baby is 48 to 52 centimetres long and is fully developed. This is a to scale drawing of a 40-week baby, and it is about the size of a large watermelon. Some more graphs to show the development of your baby and the sizes between 7 to 40 weeks. Diet in pregnancy is also very important, and you will be given information regarding your diet at your booking appointment. Your midwife will give you information on foods and to eat and avoid, and also vitamins that you should be taking during your pregnancy. There is no special diet for pregnant women, and it's best to get lots of vitamins and minerals from the foods that you eat. You will be advised to take folic acid and vitamin D during your pregnancy. And vitamin D is especially important with the current restrictions on going outdoors. Here is a slide just to give you some helpful tips for your diet. So just to increase, obviously, fruits and vegetables. You do need to still eat carbohydrates because they provide energy. It is also important to remember to keep yourself well hydrated during your pregnancy. Some people may be entitled to Healthy Start vouchers, which can also help towards getting fruits and vegetables from your supermarket. It's important to make sure that you have healthy snacks little and often, and also protein is very important during pregnancy as this helps for growth and repair. You also need to ensure that you are still having dairy as this provides calcium. The most important thing is you don't need to eat for two, is what can sometimes be a myth. Only in the last 3 months of pregnancy do you need to increase your energy levels and stores, and this is by around 200 calories per day, which could be 2 slices of bread. The information that you will have been given at the booking appointment from your midwife is also some information of foods that we do advise that you avoid while pregnant. We do advise that you try to avoid foods that are high in fat and sugar, soft cheeses that have not been pasteurised. We also don't recommend that you have any pate or liver, and that you cook your eggs fully. There is also a limit on some fish and tuna, and also to try and avoid, where possible, any shellfish or prawns. One of the most important things is to try and reduce your caffeine intake to around 200 milligrams a day, which may only be 2 cups of coffee. You will also have been given some information about smoking. It is important, where possible, to stop smoking during your pregnancy, and it's one of the best things that you can do for the health of yourself and your baby. It does reduce the risk of any complications during your pregnancy and birth, and you are likely to have a healthier pregnancy and a healthier baby. Your baby is less likely to be born too early, and your baby is less likely to be underweight. The NHS smoke-free service offers help, and your community midwife can refer you to a smoking cessation advisor. If this hasn't been done, please ask about this at your next appointment. We do recommend that you do not have any alcohol during your pregnancy, as we are still unsure of the effects that it has on the fetus and the development. The safest approach is to avoid all alcohol where possible. If you do have any problems and you would like to speak to someone, you can discuss this with your community midwife. Keeping active during your pregnancy and undertaking exercise is really important. What we class as exercise is any activity that makes you feel a little warm and makes you feel a little bit out of breath. You should remember that exercise is not dangerous for you or your baby. The positives of exercise during pregnancy are listed below, and they are really important. Some of the main points are that it helps you sleep better during your pregnancy. It reduces any risks of you suffering from any common complaints of pregnancy, such as varicose veins, swollen feet, and tiredness. There is some evidence that active women are less likely to experience complications during their labour and delivery. It also helps to reduce anxiety levels due to the release of endorphins. It also helps to keep you occupied both physically and mentally. So some tips for exercise. The most important thing is that you don't exhaust yourself. If you did any sort of level of exercise before becoming pregnant, it is safe to do so to continue this. However, we do recommend that you do reduce the level during your 3rd trimester. We advise to avoid any strenuous exercise in hot weather and make sure while you're undertaking exercise that you drink plenty of water and other fluids. We also advise that exercises that have the risk of falling or being injured should also be avoided. Exercises that you can do easily while being pregnant is go for a gentle walk alone or with other members of your household. You may also wish to do a gentle exercise class at home, and there are lots available online. You could use a birthing ball, and there is some videos online to show you how to use a birthing ball for exercise. You may also want to do a step counter, and lots of people do this nowadays, and set yourself a goal of how many steps a day you would like to do. The most important thing is to remember to stay active. The next slide shows a picture of the changes to your body from a pre-pregnant state to a pregnant state when you're growing a baby. And this is really important because it shows you the changes that happen for the space and to your organs during your pregnancy. Throughout your pregnancy, you may suffer with a few minor disorders which are completely normal. They may include vomiting, leg cramps, varicose veins, indigestion or heartburn, increased urination, feeling dizzy or faint, skin and hair changes. You may have some constipation or some incontinence, and you may often feel quite hot. There will also be some emotional changes during your pregnancy, and the feeling of growing a new life can be exciting but also can be very anxious for women, and you may feel vulnerable and overwhelmed. With the current guidance of COVID-19, you may find that these are heightened. Minor emotional changes that women can often experience include tiredness, weeping, feeling anxious and irritable. It is important to realise that these emotional changes are normal, and these can also affect your partner as well. If you are having any emotional changes, you are able to discuss this with whoever you feel more comfortable with. That may be your partner, a wider family member or your midwife. It is important to make sure that you create a good support network during your pregnancy, as this will help you postnatally. It's important also to keep in touch with loved ones as much as possible. Keep active and keep a healthy lifestyle, and take time out for yourself. Create a relaxing environment at home, whether this be music, candles and a warm bath. 1 in 10 women during their pregnancy will suffer with mental health illnesses, and it's important, if you feel that the above techniques are no longer working, that you should contact someone to get more support. This could be either your community midwife or your GP. Below on the screen is a list of things that you should have to prepare for your baby. This is just a guidance that we give to all women about what they should pack in their hospital bags. There are some useful contact numbers that you may need for when contacting the units. There is numbers for both the birthing centre and the maternity unit at Sunderland. We have also included some numbers for the crisis team, Samaritans and also domestic violence. The next class that we will be doing is the labour and delivery class.